Research focus. Title: Research efficacy of topical vancomycin powder in preventing surgical site infections in compound skull fractures. Welcome to your channel name. If you're passionate about healthcare, medical research, and breakthroughs in patient care, you've come to the right place. Here, we dive into topics that matter, from preventing surgical infections to understanding cutting-edge treatments, medical innovations, and practical tips for healthcare professionals and students alike. Whether you're a medical student, a researcher, or just curious about the science behind medicine, our goal is to make complex medical topics simple, engaging, and easy to understand. From understanding medical research and breakthrough treatments to simple tips for staying healthy in your daily life, our goal is to make complex health topics easy to understand and practical for everyone. So, hit that subscribe button, turn on notifications, and join us on this journey to explore the fascinating world of health, medicine, and wellness, one insight at a time. Did you know that surgical site infections, or SSIs, can affect up to 35% of patients undergoing delayed cranial fracture surgery? These infections increase hospital stays, costs, and even the risk of death. Introduction. Surgical site infections remain one of the most common complications after surgery, accounting for roughly 20% of all healthcare-related infections. In cases of compound depressed skull fractures, where the bone and scalp are broken and exposed, patients are particularly vulnerable. Delays in surgery, contamination from foreign debris, and compromised tissue blood flow make these wounds prone to infections, raising post-operative risks dramatically. The challenge: compound depressed fractures are classified as dirty wounds due to their direct exposure to the external environment. Studies show that even with proper surgical care, infection rates can range from 4% to over 35%, depending on timing and wound management. Each infection not only increases morbidity and mortality but also inflates healthcare costs by billions annually. Preventive strategies. Traditionally, intravenous antibiotics have been used to prevent infections. However, in heavily traumatized tissue, blood flow is often limited, reducing the effectiveness of systemic antibiotics. This has led researchers to explore topical antibiotics, such as vancomycin powder, applied directly to the surgical site to achieve high local concentrations without significant systemic side effects. Research objectives. The main goal of the study was to evaluate the role of preoperative topical vancomycin powder in reducing postoperative surgical site infections in compound depressed skull fracture surgeries. Specific objectives included documenting patient demographics, clinical status, and radiological findings, assessing timing and incidence of postoperative infections, identifying the microbiological profile of the infections, comparing infection rates between patients receiving vancomycin powder and those who did not. Literature review. Vancomycin is effective against gram-positive bacteria like MRSA and enterococci, which are major culprits in SSIs. Research in spine and cranial surgeries shows that applying 1 gram of vancomycin powder directly to the subgaleal space can significantly reduce infection rates. For example, a study in 46 patients with compound depressed skull fractures found SSI drop from 60.9% to 4.3% when vancomycin was used. Multi-center studies confirmed reductions in infections, especially in high-risk cases with dural injury or pneumocephalus. Follow-up studies showed minimal systemic absorption and no significant adverse effects, making topical vancomycin both safe and effective. Materials and methods. The study was a prospective, randomized clinical trial conducted at hospital name, over duration. A total of 86 patients with compound depressed skull fractures were enrolled. Inclusion criteria. Patients aged, age range, with compound depressed skull fractures. Presentation within, time frame, after trauma. Exclusion criteria. Allergies to vancomycin, severe comorbidities, or immunosuppression. Procedure. All patients underwent standard surgical debridement and elevation of the depressed fracture. In the intervention group, 1 gram of vancomycin powder was applied to the subgaleal space before closure. The control group received only standard intravenous antibiotics. Follow-up and outcome measures. Patients were monitored for postoperative surgical site infections over 30 days. Cultures were taken from any suspected infections to identify causative organisms. Data on hospital stay, complications, and adverse effects were recorded. Why this study matters. Bangladesh, like many resource-limited countries, faces challenges with delayed presentation and limited access to specialized care. Implementing a simple, cost-effective preventive measure like topical vancomycin could drastically reduce SSIs, shorten hospital stays, lower costs, and improve patient outcomes. Results. In this study, we compared two groups of patients who underwent surgery for traumatic brain injury. Group A received topical vancomycin powder during surgery, while Group B did not. Let's take a closer look at the findings. A total of 86 patients were included and divided into two groups. One group received intraoperative topical vancomycin powder, Group A, while the other group did not receive intraoperative topical vancomycin powder, Group B. Table I presents the demographic characteristics of the study subjects, N equals 86. Group A, who received peroperative topical vancomycin powder, N equals 43, and Group B, who did not, N equals 43, were comparable in terms of age, gender, and geographic distribution. The mean age was 21.27 plus or minus 15.50 years in Group A and 19.93 plus or minus 13.92 years in Group B, with no statistically significant difference. P equals 0.340. Males constituted 86% of participants in both groups. A slightly higher proportion of Group B patients were from rural areas, 72.1%, compared to Group A, 58.1%. Though this difference was not statistically significant, P equals 0.175. Table 2 shows the Admission Glasgow Coma Scale, GCS, scores of the subjects. The majority of patients in both groups had a GCS score of 13 to 15, 88.4% in Group A versus 83.7% in Group B. Only a minority presented with GCS scores of 9 to 12, 11.6% versus 16.3%, respectively. The difference was not statistically significant, P equals 0.534. Table 3 compares the presence of associated hematomas between the groups. Extradural hematoma, EDH, was observed in 13.9% of Group A and 11.6% of Group B. Contusions were slightly more common in Group B, 41.8%, compared to Group A, 37.3%. Absence of associated brain lesions was recorded in 48.8% of Group A and 46.6% of Group B. None of these differences were statistically significant. Table IV demonstrates the incidence of pneumocephalus. It was present in 30.2% of Group A and 34.9% of Group B, with no significant difference. P equals 0.645. Table V illustrates the occurrence of dural tears. They were identified in 41.9% of Group A and 34.9% of Group B, again with no significant statistical difference. P equals 0.506. Table V summarizes the timing of postoperative infections, N equals 5. The mean onset was 21.00 plus or minus 23.71 days, ranging from 5 to 63 days postoperatively. This indicates substantial variability in the timing of infection development. Table 7 and 8 highlight the incidence of surgical site infections, SSI, within each group. None of the patients in Group A developed SSI, 0%, while 11.6% of patients in Group B developed infections. Table X confirms the difference in infection rates between the groups. The incidence of SSI was significantly lower in Group A, 0%, compared to Group B, 11.6%, with a statistically significant p-value of 0.021. This finding suggests a protective effect of topical vancomycin powder in preventing SSIs. Table X presents the microbiological profile of organisms isolated from infected cases, N equals 5. Staphylococcus aureus was the most frequent pathogen, 60%, followed by Aeromonas hydrophila, 20%, Escherichia coli, 20%, and Enterobacter cloacae, 20%. In one case, a mixed infection with S. aureus and A. hydrophila was detected. Table 11 outlines the types of SSIs and their causative organisms. Superficial surgical site infections occurred in 40% of cases, caused by S. aureus and Enterobacter cloacae. Bone flap osteomyelitis was seen in one case, 20%, due to mixed infection with S. aureus and A. hydrophila. Brain abscesses developed in 40% of cases, with S. aureus and E. coli as the causative organisms. Table 12 summarizes laboratory investigations. Hemoglobin and ESR were similar in both groups, with no significant differences. Preoperative CRP was also comparable, P equals 0.903. However, postoperative day 3 CRP levels were significantly higher in Group B, 42.52 plus or minus 26.96 milligrams, L, compared to Group A, 21.40 plus or minus 9.44 milligrams, L, with a p-value of 0.001, indicating a clear difference. Table 13 shows the association of ESR and CRP levels with SSI. Patients with infections had significantly higher ESR, 43.40 plus or minus 24.60, compared to non-infected patients, 36.26 plus or minus 23.70. P equals 0.011. Preoperative CRP, 45.46 plus or minus 36.70 versus 35.05 plus or minus 20.81, P equals 0.001, and postoperative CRP, 61.07 plus or minus 48.01 versus 40.01 plus or minus 46.92, P equals 0.001, were also significantly higher in patients who developed SSI. Discussion. This study was carried out at Chittagong Medical College Hospital with one main goal: to find out if applying topical vancomycin powder during surgery can reduce postoperative surgical site infections in patients with compound depressed skull fractures. Age and gender trends. We found that most patients were young. Nearly 1/3 were under 10 years old, and another large group was in their teens and 20s. This is not surprising. Similar studies worldwide also report skull fractures mostly in younger people. When it comes to gender, about 86% of our patients were male. This matches global trauma trends, where men are more prone to injuries due to risky behavior, occupational exposure, and lifestyle activities. Associated brain injuries. Some patients had additional injuries like extradural hematomas, contusions, or dural tears. But these were almost equally distributed across both groups. This means the severity of trauma was similar, and it didn't explain the difference in infection rates. Consciousness levels, GCS scores. Most patients in both groups had high GCS scores, meaning they were relatively stable when admitted. Again, this reflects similar findings in other trauma studies. Lab markers, hemoglobin, ESR, CRP, before surgery, hemoglobin and ESR values were nearly the same between both groups. CRP, a marker of inflammation, was also similar before surgery. But after surgery, something remarkable happened. Patients who received vancomycin powder had significantly lower CRP levels by day 3. This suggests less inflammation and fewer infections, while CRP levels remained high in patients who did not receive vancomycin. Surgical site infections, SSI. The most striking result was infection rates. Not a single patient in the vancomycin group developed an SSI, while about 12% of patients in the control group did. This difference was statistically significant and strongly suggests that topical vancomycin helps prevent infections. Type of infections and bacteria. Visual. Animated microbes with names appearing: Staphylococcus aureus, E. coli, Aeromonas, Enterobacter. When infections occurred, Staphylococcus aureus was the most common culprit. Other bacteria included E. coli, Aeromonas hydrophila, and Enterobacter cloacae. Some patients developed superficial wound infections, one developed bone flap osteomyelitis, and others even had brain abscesses. Interestingly, we also noticed gram-negative bacteria appearing in these infections, which may indicate a rising trend in developing countries. Comparison with other studies. Our findings agree with several international studies. For example, Oysel and colleagues in 2023 reported SSI rates dropping from 60% to just 4% when vancomycin powder was used. Another randomized trial by Atala et al. In 2021 also showed a major reduction in infections. Ravicumar's study in 2017 found similar results, reporting infection rates falling to 0 after adding vancomycin powder. Key takeaway. In summary, our study shows that topical vancomycin powder is highly effective in reducing surgical site infections after surgery for compound depressed skull fractures. By lowering postoperative inflammation and preventing bacterial growth at the wound site, it can dramatically improve patient outcomes. Conclusion. In conclusion, our study highlights an important finding. The use of vancomycin powder during surgery significantly reduced postoperative inflammation, as shown by lower C-reactive protein levels, and most importantly, it completely prevented surgical site infections. This suggests that topical vancomycin can be a powerful tool to reduce infection-related complications, especially against common bacteria like Staphylococcus aureus. While the results are promising, more research is needed to confirm its long-term benefits and explore its use in wider surgical settings. Limitations. Like every study, ours had some limitations. First, follow-up of patients was sometimes difficult. Second, due to financial constraints and limited facilities, we could not measure the intra-wound inhibitory concentration of vancomycin or the serum levels after its application. These would have provided deeper insights into the drug's effectiveness and safety. Recommendations. Based on our findings, here are our recommendations. The routine use of vancomycin powder should be considered in all cases of compound depressed skull fractures. Future studies should measure intra-wound and serum concentrations of vancomycin after local application to strengthen the evidence. Continuous monitoring of postoperative inflammation markers like CRP, along with patient-specific risk factor assessment, may further improve outcomes. And finally, larger multi-center studies of longer duration should be carried out to evaluate its role in preventing infections across all neurosurgical procedures. Our study strongly supports the potential of vancomycin powder as a preventive strategy in neurosurgery. With more research, this simple step could help save lives and reduce complications worldwide. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more medical insights made simple.